Hello, everyone. My name is Dr. Yonit Arthur. I'm an audiologist and coach. You are on the Steady Coach. Now, if you're dealing with chronic, medically unexplained dizziness symptoms, visual symptoms, tinnitus, or any other neural circuit symptoms, you've probably been told many times that your symptoms can only be managed. You already know that the biomedical model falls short for you. Today's guest, Dr. Roger McFillin, knows why that message is wrong and why applying temporary patches is not going to get you the best results. Dr. McFillin is a clinical psychologist and host of the Radically Genuine podcast, and he's on a mission to help dismantle this drug it or dismiss it approach in the realm of mental health conditions. In his work, he often talks about how human distress is over-medicalized and why that keeps people from true recovery. So in this conversation, we dig into why numbing distress or symptoms can backfire, how stress, fear, and hypervigilance keep your nervous system in a loop, the role of real emotional processing in regulating the nervous system, and how you can reclaim your agency as no longer just a patient. I think this is a thought-provoking conversation, and I'm looking forward to hearing your feedback on it. So if you have thoughts for me, please put them in the comment section here on YouTube. You can also like, share, subscribe to my channel, and please be sure to give the podcast a follow. These things really help me reach more people. Enjoy this conversation with Dr. McFillin. Dr. Roger McFillin, it is such a delight and an honor to have you on my channel. Thank you for joining me.
Oh, it's an honor to be here. Thank you.
I think we're about to have a very interesting discussion, but to give everyone just a point of reference, can you just tell us a little bit about yourself?
Sure. I am a clinical psychologist, and I run a large center in Bethlehem, Pennsylvania called Center for Integrated Behavioral Health. I'm best known for my Radically Genuine platform, which is the Radically Genuine podcast with Dr. Roger McFillin, which is in now the top 0.05% globally. Where I speak to a lot of issues related to popular culture and mental health, especially the psychiatric industry. It's psychiatric
in a totally uncontroversial way, right?
Well, it's quite controversial, and I think that's probably what brings the attention. It's very outside of the mainstream. But, as we were talking earlier, I think a lot of what I talk about is supported by two things: common sense and actually strong scientific data. It's the data that gets manipulated for industry and to support a large medical apparatus. And so I'm trying to parse through that and talk about what it really takes to live well. I also write for Substack. Again, that's under Radically Genuine, and have a provocative social media accounts on X and Instagram. And finally, I also started a nonprofit called the Conscious Clinician Collective, which is a database of like-minded mental health practitioners who want to kind of restore sanity to all this, and people who want to operate outside of the paradigm that anytime we suffer or struggle in life, it's some biochemical illness to be drugged. And so that, along with other ideological kind of indoctrination that is incorporated to the general mental health field. So it's practitioners who are like-minded, who want to step out, be part of a database, really support informed consent and medical freedom. That's the Conscious Clinician Collective. It's just started a searchable database.
Wonderful. And I'll include links to all these things in the video and podcast description. But I'm sure those of you who are familiar with my work, your ears perked up when you heard Dr. McFillin say that he opposes this idea that everything that goes wrong in life might be a biochemical problem. So to just make sure we're at a common reference point, Dr. McFillin, as I shared with you before we came on today, I work with people with chronic vestibular or chronic dizziness issues, most of whom do not have anything medically wrong that explains their symptoms. Although it may have indeed started with a medical problem, it usually ends up being a hodgepodge of different symptoms and different diagnoses that basically describe symptoms, but don't really describe the root of any kind of problem. And now in the past, maybe 10, 20 years ago, these people may have been dismissed as just being anxious. now the pendulum has swung so far in the opposite direction that now they're being highly medicalized. So anything that these folks have is now being treated with medications, migraine medications, SSRIs, benzodiazepines. They're being sent to physical therapy. And I'm not saying that those aren't useful treatments, but they obviously don't get people to where they want to go, as evidenced by the fact that I have a YouTube channel that people like to listen to. So my question for you, everything I've said so far, I think parallels some of the things I've heard you say about depression, ADHD, panic disorder, maybe even anxiety disorders. And I'm curious to hear your take on what the problem is with taking a purely biomedical approach to these disorders might be.
Well, first of all, it's a very antiquated and failed paradigm of care that has produced really poor outcomes. So when I say a paradigm of care, it's the reduction of all aspects of the human experience to sometimes singular biomedical constructs that can be targeted with a drug. And it's really created out of boardrooms and pharmaceutical companies rather than pure science. Now, we are physical beings. I think we're spiritual beings actually in a physical body, but we're in this physical world. So there's brain activity and there's physiological reactions to all aspects of our being, including every time we have a thought, an emotion experience has physical manifestations and reactions, food we put into our body, the type of sleep we get, whether we're exposed to light in nature, all such things. But it is the identification of something that is causal and reduced to be prescribed drugs, which I think is the failed paradigm of care. And I think we're entering into a new era where we're expanding our understanding of what it means to be a human being to include, legitimate biopsychosocial spiritual constructs and understand us to be energetic beings. I think where I'm interested in is a lot of post-material science that says that we are energetic beings and we are emitting frequencies. We can measure those frequencies now. It's a biofield, and these things have a lot to do with our health as well. Trying to look at some root causes of disease, and we are experiencing a chronic disease epidemic here in the United States, is we have to look at all the aspects of our lifestyles that are leading us to feel so poorly mentally and physically. Now, that includes the poison in our food system, environmental factors and toxins that we're exposed to, but also like what we're kind of ingesting through media and our emotional components of our lives and how we respond to stress and how we think about our lives. All of these are really emotional components that have bidirectional relationships with our immune function and interact with our physical well-being that can be measurable. There's a burgeoning field called psychoneuroimmunology. I think it's absolutely fascinating. It's how stress impacts disease in the body, how our own thoughts, our lifestyle, and all those things. So in my platform, I want to speak to the complexity of what that means to be a human being and anything that tries to reduce it to a physical construct that ultimately leads to a pharmaceutical. And in my field, these pharmaceuticals are highly problematic. They have significant adverse reactions. When you look at the data, they don't have meaningful benefits to placebo. And due to the adverse reactions and the long-term health consequences, to me, they're absolutely a net negative in our culture. But they're pushed more and more and more because you need to have more customers in order to really meet the needs of your shareholders. And that's what the pharmaceutical industry has successfully done, is they've tried to increase the amount of people who identify with mental illness so you can push more and more drugs. And they've successfully done that. They've done that across conditions. They've pushed this into primary care settings. This is way beyond just psychiatry. This is anywhere that you intersect with the medical model in the United States, the allopathic medical model. They are providing quick labels, prescription drugs, and never really getting to the root cause.
So I'm going to steelman this from that perspective on behalf of the people who are helping people with vestibular problems. This isn't necessarily my full viewpoint, but I'm going to steelman it. So what happens when people have chronic dizziness or other functional neurologic disorders, essentially, is those people are in incredible distress. and often don't have the skills or tools to work with that distress, in particular in light of the fact that our society tends to view distress as highly problematic, even when it's an appropriate response to something like chronic symptoms or having an initial vestibular problem. So I think providers they're aware that SSRIs and benzodiazepines and SNRIs and some of these other drugs that my people are often being prescribed, that those are numbing agents, but they see that potentially as the only way to pull someone out of that cycle of distress that they're in. And I'm completely with you on the potential side effects. And again, I think you and I are in agreement over the harms of these things. But I'm curious if you can speak to the idea that numbing someone chemically is the only way out of these levels of high distress.
I would say absolutely not. And in fact, it's really the idea that dealing with emotional distress through numbing as being a primary way of regulating emotions is really in conflict with everything we know about decades and decades of science on emotion regulation. So first of all, we have to define what emotions are first. They are literally energy in motion. Okay. So everything that we experience is a very important signal. And that signal is something that we're supposed to be paying attention to. It provides us information. Numbing or suppressing emotional states are certainly factors in root cause of disease. The disease is the way I look at it is your body's no longer at ease, right? And that can manifest itself in a lot of medical conditions and diseases down the line. I know they're looking at that as root causes in certain cancers. There's a number autoimmune conditions. Like, I think when you look at where we are in contemporary medicine, they acknowledge that emotions are powerful energy, and suppression and avoidance of emotions have problematic health consequences. So what happens when you take a drug? And listen, a benzodiazepine is powerful. As much as I would say that an SSRI doesn't provide a whole lot of benefit, I would tell you that a benzodiazepine, if you're really, really anxious and you're on the verge of a panic attack, or you can't sleep because you're so anxious, or you need to get on a plane and you have a phobia of a plane, it's going to work. It is powerful, and it will sedate you. The problem with a benzodiazepine, within 10 to 14 days, your body's already adapted to it. So there's high levels of dependency. And then you're actually never learning how to regulate and tolerate distress. So it's getting in the way of your long-term recovery. And I can acknowledge that there's some short-term benefit to a benzodiazepine. SSRIs don't have the same level of benefit. I mean, there is an emotional numbing component to it. About 67% of people surveyed when they take an SSRI feel some form of emotional detachment or numbing. But that's also aversive for a lot of people, because it's also numbing positive emotions. It's also numbing your genitals. It's numbing your libido. It's actually really altering who you are as a human being. But emotions in themselves are always temporary. I mean, that's the most important thing to always remember, that no matter what state you're in, if you allow that state to be there and you have some skills and tools to be able to move that energy and ground in the present moment and deal with what is happening, that energy is going to move, and that episode is going to be rather short-lived. I know how overwhelming and scary and difficult it could be to be in one of those episodes, especially if you don't feel well physically. But obviously the emotional component of this exacerbates everything that you're feeling physically. So if you're having symptoms of dizziness and balance, for example, that's also a symptom of high stress and anxiety. So people who are in chronic stress and anxiety also feel very lightheaded or dizzy or not grounded. And so there's various interventions and ways of working with somebody who's in that high level of distress that you can help them move through that. I think it's the most safe and most effective long term, and that is what we should be providing people.
Mm-hmm. Yeah. Well, even more than that, I'll take it a step further and say that for the people that I work with, it's not that the stress or anxiety or uh, dysregulation is what's making symptoms worse. It is the root cause at some point of these emotions. I mean, of these symptoms, because it's perpetuating a cycle of attention on and hypervigilance about body sensations. What I often describe, I have a few different ways to describe it, but one thing that I describe is prediction error, where your brain is misunderstanding a particular trigger as a dangerous thing, and so then it reacts in an appropriate hypervigilant way. But then your own behavior, your own responses, your own inability to be with the distress of what happens then basically feeds that hypervigilant response, and your brain continues to basically reinforce itself into that cycle. So very similar.
Yeah, well, it's the root cause of like how we treat panic attacks. Panic attacks is a hypervigilant on sensations of fear and anxiety, which exacerbate that into a panic attack. And the most effective treatment is exposure and emotional acceptance. So the work that we do in my center, I do individually, is interoceptive exposure work. You get people to face that experience, and then ultimately you build skills to draw your attention away from it. The more you fear your internal sensations and the more internal experience, then you're creating an entire focus and intention on all of those symptoms, which what's the consequence of that? Exacerbating the intensity of it. So a fear of fear is a good way to describe origins of panic attacks. And that's what we've done in the medical system is we've created almost a fight for people with their internal experiences. So
that's
if you view your thoughts or your emotions or bodily sensations as very dangerous symptoms of some unknown disease, then you create all kind of fear and conflict around it. And ultimately that becomes real problematic because, as you well said, you are now have this hypervigilance to anything that could go wrong with you. And you are living in a state of stress, even if it's just mild stress.
Yes. And that stress, as you said, has both real concrete effects on the body and real concrete effects on how your nervous system processes information. And since all information and sensory information is filtered through the central nervous system, if your central nervous system is not processing the threat response the way that it should, or it's not assigning threat to the correct things, then your sensory processing is going to be affected. Your actual physical experience of interfacing with the world is going to be affected. So obviously we're in agreement about this. And I really appreciate you allowing me to steelman the argument for SSRIs and benzodiazepines. I think most people watching this channel are understand that that's not the way out. So when you say psychosocial or psychological treatment, so what you described, I kind of see this in layers. So you described for the treatment of panic disorder, a way of changing your responses and accepting the bodily sensations and becoming more comfortable essentially with the distress and discomfort of the interoceptive signals. I wonder if you have anything to say about whether there's a deeper root cause that may trigger people to go into this state, and whether that should also be addressed for people to achieve full recovery.
Yes, of course. And one of the things you realize is that each person has their individual story, their own history, and there are many reasons why someone may become their nervous system may become overwhelmed. The most frequent is some unresolved trauma event. That's something that we see quite frequently. One of the ways that people cope with some very horrific and traumatic things that have happened in their lives is just to get really good at not thinking about it, or really good at setting up your life just to survive and to prevent all these things. So you set up a life of avoidance and you try not to think about it, which is probably the primary factors in what develops later PTSD symptoms, because those memories, the energy, the emotions around them are meant to be processed. They're meant to be moved. It's something for your own transformation. It's for you to overcome in your life. And what's called avoidance coping, when you cope through avoidance, you're going to see there may be nightmares. You might have what's called panic attacks out of the blue. There could be some kind of trigger or prompting event in your environment that you don't even necessarily connect it to another period of time, but it's associated with past danger. So that's the primary one, is that there are traumatic events that occur.
Okay.
Additionally, there's a lot of people who are in situations in their lives that at the very least are unfulfilling, at worst could be dangerous themselves. So they could be like really bad relationships that are emotionally abusive or unfulfilling. Some of them might be physically dangerous. They could be facing real legitimate stressful events in their lives compared to with loved ones or finances. And depending on how they process that experience and process those emotions, what I always tell people is that we can't just put away and avoid those situations, because they're going to continue to come back up in our lives in various ways. That's why I look at physical sensations, emotions, even diseases as signals, as messages for us in our lives. And there's a spiritual component with this as well, that they're there to serve you. And I share that perspective with all my clients. No matter what you're going through, I truly believe in my heart that it is there to serve you. On my podcast, I've interviewed oncologists and medical professionals who've seen what's called spontaneous recovery or medical miracles. Cancer patients who had stage 4 cancer were pretty much left to go to hospice to live out their days, and they chose alternative paths, and they faced things that happened in their lives and have seen spontaneous remission of cancer tumors. I think there's a psycho-spiritual component to our health that we are only on the precipice of being able to fully understand when we can understand energy and quantum mechanics and so forth. But bottom line is this: I look at everything as a signal for us to pay attention to get to whatever that root cause may be. That root cause might have other real legitimate toxicity or physical causes. I mean, we're at a time in our evolution as human beings that we're exposed to frequencies that have never been part of our adaptation and evolution history. 5G, for example, EMFs, all these things this is the first time human beings have been exposed to that level of frequency. And frequency EMFs do have physical manifestations of illness and sickness. So there's so much that we don't talk about enough that are part of our adaptation on planet Earth. But yes, there are root causes. And I think the benefit of being in a psychotherapy or working with a doctor who can take the time to really get to know you, develop a relationship with you. It could be a safe, supportive relationship where you go through that history. You're much more likely to be able to identify some of the challenges that you need to face in your life. In a medical system that sees you for like 15 minutes at best and writes a prescription, sends you on your way, and gives you a label, that's not healing. That's just trying to temporarily suppress symptoms. And we know that that doesn't work.
That's right. Especially not for these complex issues. Like, again, what we talk about here on this channel. You know, I'm always struck by how people will so often tell me, you're the first person who's ever asked what was going on in my life when the symptoms started. And I agree with you. There's just to ignore the whole picture of the whole person and to assume that we only need to look at one dimension of a person to treat them it's obviously not going to work. But that's the issue that I often have with some of these newer, like functional medicine ways of looking at things. I'm very open-minded, and I want people to be healthy, and I want people to address any deficiencies in their diets and all that. But sometimes I see that happening as yet another biological rabbit hole, rather than exploring, I think, this completely unexplored dimension that's psycho-spiritual. And that, again, it's good that you've gotten out of maybe the conventional medical system, but if you're just going to someone who's going to give you supplements and a diet and just keep digging for biomarkers that are problematic, you're not necessarily addressing the root issue at all.
Yeah, that's the danger of kind of our capitalistic system that is looking to sell you something, is that when you try to reduce the complexity of all this to something that's simple, like take a pill, like just take magnesium or change this, which can be helpful. I don't want to deny that those things are helpful. I think there's a large percentage of people, for example, in the United States who are magnesium deficient, and that can manifest itself in symptoms of anxiety and poor sleep. But if you're looking at that as the sole solution to complex experiences, most people are going to be let down. And then go back to what you spoke about before, which is, where are we going to focus our attention in our lives? When you focus your attention inward on everything that can be wrong with you, I call this a fear-based consciousness. I think when you're constantly producing fear-based consciousness, thoughts, experiences, attentional biases, you are living on a very low level of a stressful experience. We're not designed to be under constant stress. Stress is used to survive. Like, if there's a moment where we need to act, we'll get cortisol and adrenaline, and it's a fight or flight reaction, and that's survival. But because of our minds, because we have this ability to create threat in our experience when threat doesn't exist in the present moment, then we can create just a low level of consistent stress and worry that has real physical consequences. So ultimately, like, there has to be a skill that you develop in your life to be able to quiet the mind, to connect fully to the present moment, and to live in what I call flow, the flow of life, by surrendering to that and learning to get out of your head. And I'm finding it's much more challenging and difficult for people to get out of their own minds and out of their own heads, because there's so much constant stimulation. You have that phone technology. It's like, anytime that you want your attention to get directed by something, to be distracted by something, you have that availability in modern culture. And there's real consequences to that, because then we start labeling it as if it's a genetic condition. We start calling it ADHD. We call it a medical condition, when these are predictable consequences to lifestyle issues of our modern living. And you see people are more disconnected from nature than at any point before. They're exposed to LED lighting and artificial lighting that has real severe consequences on mood, sleep, behavior. People are working in cubicles, indoors. There's more social isolation. Like, we cannot continue to oversimplify the solutions to these problems without looking at the totality of all the factors that not only are affecting that one client, but it's affecting us as an entire culture.
Yeah. Okay. So then, as someone who works with anxiety, I think you'll have a good answer for this one. Often the people that I work with are very aware of those things that you mentioned. They're really thinking about LED lighting. They're thinking about sleep hygiene. They're thinking about, getting their steps in and eating well. Maybe not all of them, but most of the people that I come into contact with actually are maybe even overly obsessively worrying about those things, about those physical things that are in their control, and they have a lot more difficulty doing some of this more internally focused work. But then, as you pointed out, constantly focusing inward and asking yourself, how am I feeling? How am I doing? That actually leads to poor mental health outcomes. So maybe you can help people understand how to find that balance point, and what a healthy relationship with all those things that we just mentioned might look like.
Yeah, I've written on this extensively about the obsession that exists in our culture and the obsession that can take place over our own health.
Yes.
I personally have gone down that rabbit hole too, because I'm interested in living well. I've tried all different types of protocols. I've gone ketogenic diet and fasting, and I've done all these things. And always the result of doing all those things, I become a lesser version of myself. I become focused on me. I become more obsessive. My attention is driven to areas of my life that are really not that important. When I think about what's most important in my life, it's everything outside of me. It's serving my clients. It's my family. It's learning. It's being connected to nature. But most importantly, it's learning how to fully embrace the moments that exist with intention. So if you're trying to look for balance, right, anything can become an obsession. Even if we talk about meditation, for example, which I engage in on a regular and consistent basis because of the profound benefits it's had in my life. I've met people who want to detach from all of life and go into meditation.
Yep.
And so that word balance is so important. I always think about it as having like one foot in the physical world, one foot in the spiritual world. And when I go into meditation, which it took me a long time to get to this skill, I think I started off slowly with being very mindful in my life. I refer to myself as previously a high functioning anxious person. In order to accomplish the things I've need to accomplish in my life, I had to always be on top of everything, from going to graduate school, starting a business, raising my kids, handling everything I needed to do, and all those commitments. I was not living in the moment. I was a doer. I was completing things, but I was not in the flow of life. I didn't experience the joy of life. Had sleep problems, and I was a worrier, and I wasn't at my best health. So just the slow steps of being able to kind of shut that mind off and be connected to the present moment, from the food I'm tasting to walking on my grass to looking at the sun to really being present with my kids' laughter, or things are going on in my family, or reading a book for enjoyment, just to sit down and to refocus the mind, allowed me to grow to a point where I can start my day with some gratitude and then shut the mind down in a meditative state, and just surrender. For me, it's surrendering to God, or it could be surrendering to your higher self or your guides or whatever that is, and just to fully be present. And you're always practicing this ability to kind of detach from the inner workings of your mind, that mental chatter, because it's always creating stories. When I sit down with clients, I'm telling you, the first thing I'm doing is getting to know you, but I'm observing the story you've created about you, and the story you've created about your life. And I'm telling you, that's a story. That is a creation of you, of course, in relationship to all the events of your life, but you're the one who's making sense of all those events. It's going through a filter system. Your mind is creating a version of you, the world, everyone else. And so I'm listening very intently to the story that you created, because I think part of the goal of really good help is you learn to observe that story, see it as a story, and there's what's called cognitive diffusion. There's a distance. You get to see your mind create stories. You get to see when you're worrying, when it's going back in the past and it is replaying shameful events. Remember, all of those have a chemical reaction. That entire experience has a chemical reaction on your entire body. So when you can get good at observing the story, you get to stop. And then you intentionally choose to live fully in that present moment. And I have a great job, because as a therapist working individually with clients, if I'm thinking about my next client or the one before, I'm going to be completely ineffective with the person that's in front of me. So I'm just really good at seeing that moment to be a blessing and to focus my attention so fully on that person. I have a little mantra: this is the most important person in my life. I said it to myself before I met you coming on this podcast. This is the most important moment of my life. You're the most important person in my life right now. I know people look at that and say, oh, come on, you don't believe that. But the truth is all I exist is right now. This is the only moment that I can create in. This is the only moment I can live in. And then my attention and my energy is fully cultivated in that present moment. Mm-hmm. So I think the best way to understand people who are in states of anxiety is their stories and their minds are in a place of fear. And without being able to have tools and ways of being out of that experience, you're stuck there. And that's why you're going to turn to drugs or alcohol or social media or bad food to try to feel better. You're always trying to calm your nervous system that is stimulated by those threat-based stories that are so prevalent in today's society. And you can just turn on any social media or mainstream news, and what are we talking about? We're talking about war. We're talking about death. We're talking about climate change. It's constantly bombarding you all the time to provoke fear, because that's what's going to get eyeballs. That's what's going to get attention. And I think we just have to pull our attention away from all of those things, and you have to choose what's most important. Where are your values? And that's where your attention should be focused on. Everyone who's focused inward on their body and fearful about their own death, and ultimately comes to an attachment to this body and to this life, and now you end up not truly living, which is the irony of all of this is you're so afraid of not living. You're so afraid of dying. You're so afraid of the medical catastrophe or whatever that may be, that you're not fully living in the life that's presented for you.
That's right. That's right. And I recognize, I just want to be sensitive to the fact that some of you listening are going to find this very difficult to hear, because you might be saying to yourself, but I have physical symptoms and that's why. And I just want to be very clear. No one is denying the level of suffering you're experiencing with the symptoms. At the same time, there's at least a large part of the suffering that is from the story that you're telling yourself about what the symptoms mean and what's going to happen from the symptoms and what's happened before and what it means about you, what it means about your future. A lot of it is a story. And so one of the tools that we use is something called somatic tracking, which is basically just being mindful and present with the sensations without trying to do anything about them, not trying to make them better, not trying to make them worse, just we're right here, right now with the sensations. But what you're saying, and I think this is a wonderful practice that people should consider, is you don't necessarily just need to practice that with symptoms or sensations or problems or thoughts or anxiety. You can practice a similar process just doing normal everyday things, just being present in normal everyday life. And that is actually the remedy to this over focus on sensations and thoughts that you're experiencing.
Absolutely. There's what I call setting intentions. So when you look at your day, it ends up probably being in certain blocks throughout the day. Like there's certain things that you have to do. There's a routine, there's work, there's family life. Setting attention is shifting consciousness into that present moment. So I might set an intention like I want to be fully present and guided on this podcast. I want to be fully empathic and truly understand the person that's sitting in front of me.
Yeah.
I want to, as I'm making food, I want to make the best meal I possibly can. Like setting these intentions to get you into that moment is something that is something that you can do every day, and it helps in decrease impulsivity, reactions that you would rather not display. You're more aware of your emotional experiences and your own thoughts. Remember, I spoke earlier about all this being energy, and I think we're on the precipice of understanding us as energetic beings. Energy is designed to move. I think we're also probably creating with a greater field and a greater consciousness. So everything we're putting out is being experienced in the field. We're measuring the biofield. So we want to be aware of what we're producing and what we're creating. And when you're intentional about what you do in your life, you're just much more present. And then you are creating according to what is most meaningful to you. Yeah. And so getting in that habit, I think is really important.
Yeah, definitely. Okay. So I guess this brings us to sort of a bigger question. People are maybe here watching this channel because they want symptom relief. And I do not consider symptom relief to be recovery. So I'm curious to just hear, what's your definition when you work with a client? And I recognize we're not necessarily seeing the same symptoms, but when you're working with a client, what does that even mean? What does recovery mean?
Well, I think it depends on the condition that what they're going through. So I certainly don't want to invalidate somebody's physical suffering.
Sure.
But if you're working with me, I'm a psychologist, and I'm relying on a base of good research that exists in my field. One of them is like the gate control theory of pain. So we know that people who are actually thinking about their pain or their injury experience significantly greater pain and have decreased mobility versus somebody who has attentional control strategies. And there's a wide range of pain tolerance. I mean, we see this in athletes and so forth. The bottom line is this, that the more you're thinking about whatever's bothering you, the worse those symptoms are going to be. Now, if, for example, I have symptoms related to type 2 diabetes, and that's related to all these lifestyle factors that have emotional components, right? You're
Sure.
eating bad food. You might have a sedentary lifestyle. You're metabolically sick and you're metabolically ill. But when you do the work with me, we realize that there's a function to your lifestyle. There's reasons that you're turning to that food. There's reasons in your life that you're trying to escape through that in the same way someone might escape into drugs. Recovery for me would be, I would fully would want that person to become metabolically healthy, lose weight, stop binge eating, change their diet, deal with their emotions and their stress effectively, and have a full recovery. So it depends on what is happening.
Sure.
But often, especially in the mental health world, there's this paradoxical effect to our experience in being a human being. The more we try not to feel something, the more we do. So if you're trying really hard not to be depressed and trying to be happy, it's probably going to have the opposite effect. Same thing if you're trying not to be anxious and you're trying not to be stressed. Instead, what recovery looks like to me is, what does a life lived well look like? And tell me, what are the actions aligned with your highest values? Most people will come down to cultivating relationships and loving relationships in their life, being in service of other people, being creative, learning and growing. I'm going to help people get focused on those things. Many people have problems they need to face that are getting in the way of living that life. When you do those things without focusing on your depression or your anxiety, the consequences tend to be quite positive, in which that we measure, where you were when you started therapy with me to where we are after therapy is over. And there's a lot of significant changes, but we focused on your life. We focused on changing your life. I would imagine it could be quite similar with these complex medical conditions that have this bidirectional relationship with stress and lifestyle and a number of things. Is the more that you're going to focus on what's wrong with you, the worse you're going to feel. But when we really control attention, focus back on your behavior and living your life fully, the positive consequences is that, it's not as bad as it was. And that's what we see. Everything's contextual. So even when people come with me with some of these physical complaints and these diagnoses that you work with, of course, they know I'm not going to be able to heal that for them. That's not something I'm doing as a psychologist. I'm not a medical professional in that way. But we realize that there are times that they feel better. We realize that they're not always suffering in the way that they're suffering. So what's happening? If these come in discrete episodes, what's going on in their life that leads them to respond in that way? What exacerbates it? What's going on in their mind? Where are their stories? What's the life that they're living? And that gives us plenty of information. And then we can plan that into their lives to make significant changes. And the positive thing is you look back and say, I am doing much better, or I am feeling much better than I was doing previously.
Yeah. And ACT, I hear you describing a lot of ACT in this conversation. It has been studied for these conditions, and definitely it seems to be superior to CBT, that, kind of more conventional first wave type CBT for helping people with these symptoms. I'm going to take it a step further, though, and say that in my experience, again, when there is something physically wrong, and we're managing something that's physically wrong, then that's that's how we're going to frame the expectations. I've set the bar higher for my clients because it's not just bidirectional; it's primarily unidirectional in the sense that it is truly the fear and stress. The perpetuation of these fear and stress cycles that's leading to the physical symptoms in the first place. And to set the bar at management is too low. And I find that when I send people to psychologists and to therapists, they're afraid to say this to my clients. They're afraid to acknowledge that the mind and body are one system. And we're not just working above the neck to help you accept your symptoms better and live better, although that is a worthy goal and an important intermediate step, no matter where you are on this spectrum of biopsychosocial. But when you're dealing with symptoms that, in my opinion, and I think the research supports my opinion, are primarily driven by psychosocial factors, then there should not be an artificial divide between the mind and body. When we're treating the mind, we are directly treating the body, and we can see symptom cessation, not just symptom management. So I just want to put that out there, maybe for you to hear, but also for anyone else listening to this to hear that in my experience and opinion, this is completely possible for people with these kinds of conditions.
No, I mean, I'm glad I was able to hear that. And I certainly am grateful to hear that. I understand where the fear comes from, because these are maybe of unknown origin, or
yes.
the client and the medical professional are saying there is a physical issue.
Yes.
And so a therapist or a psychologist would hate to be in a position to make everything about the mind. And everything's about conceptualization, formulation. So maybe if that person came in to see a psychologist first and believed it was due to stressors in their lives, without getting this organic medical explanation, then we're free to work with them from our area of expertise. But if they're coming in and they've got these diagnoses and they're seeing these physical therapists and these other therapists, then who are we to kind of deny that experience for somebody? We're going to work from our perspective and do the best that we can. And then when somebody comes in and maybe they're not doing as well as they hope to, I can really see where in the system it becomes about management and then really lowering the bar. I can see how problematic that could be.
Yeah. Yeah. And it's, I think the problem is that the tide of our current cultural stuff pulls us in the direction of looking for biomarkers, looking for biomedical problems. So patients themselves, psychologists, everyone, all of us are just kind of in the cultural zeitgeist looking for biomedical or biological problems. And if you look hard enough, you're going to find something. But mechanism does not equal cause. So when I see these folks diagnosed with PPPD or MDDS, for example, basically these are diagnoses that describe symptoms. That's what these diagnoses mean. It says you have this kind of dizziness and you've had it for longer than a certain period of time. That's all it says. So we now have studies that show, well, on fMRI, these people have alterations in blood flow or electrical activity. Well, no, duh, we do. They're dizzy. They're not just making it up. So of course we see these changes, but that's just mechanism. That doesn't explain why. So again, I'm aware that a lot of the things that we're talking about are definitely in a gray area for psychologists. I'm hoping that some of the people from your audience who end up seeing this might take a second look at some of the patients they're seeing who have some of these diagnoses and say, am I setting the bar too low by saying this can only be managed when the problem really is being fed by these psychosocial factors? And if dealt with well, maybe the problem won't exist anymore.
Yeah, I mean, great points. And just to piggyback off that, when we're talking about mental health, because we see that same biomedical paradigm with trying to identify this as a brain illness. People don't realize that this poor science that's put out about using fMRI or PET scans or other just to identify brain activity does not mean that that's a causal relationship, that there's some genetic issue that you have. Therefore, we can reduce it to that as being the cause. Bottom line is this: if you had these machines in your home where you could have an fMRI or PET scans or all these things that identified brain activity, like if you were happy in a good relationship, your brain would be, lighting up in different places and showing activity in different areas. If you were going through a breakup, if you went through a couple days of being sick, you weren't outside, your sleep was off, you were a little bit more stressed, you're in the moment, all these things are going to show physical activity within the brain. That does not mean that is your baseline. That does not mean your brain's not functioning adequately. It's just demonstrating the physical manifestation of that experience at that time.
That's exactly right.
I've had conversations with leading neuroscientists, neurologists, and I say, on a scale of 1 to 10, 10 being we fully understand this organ we call the brain and all its intricacies. One being, we know very little. We're at a rudimentary level. Most of them, who are going to be honest, they're saying like a 2, maybe a 3. And I just had a wild podcast episode that I'm releasing Thursday with a professor of psychiatry at Columbia University, where I had him in studio in front of me, and he was making the most wild claims. And they tend to use language like, we know this right now. The data is clear. It's this authority bias where they try to reduce it to their limited understanding, and then they communicate that to the general public. And the unsuspecting public wants the quick fix. That's why we want to reduce something down to the physical, because we grew up in an era where you can have strep throat, you can take an antibiotic that kills the bacteria, you overcome strep throat, right? But you really think about our medical, what we treat in the allopathic medical system, there's not many quick fixes at all, but we're kind of conditioned to believe that to be true. That's why so many people go to the doctors all the time. They'll go to the doctors during the normal course of an illness. It's just going to be a virus or something that's going to run its course. And, the doctor gives you something, and then you think that's what led to your recovery, but it was just its natural healing course that existed. And there's real problems with seeking out the medical establishment, from really handing over your agency to your own health and well-being to somebody else. And now they're in positions where they have to be the expert or be the authority. And they're not really good saying, I don't know. It's very challenging for somebody who's put that much time into their education and has achieved this status in our culture, just to tell you, hey, listen, I'm really sorry that you're struggling. But you're gonna have to find this within yourself. There's no quick fix, and there's no medical cure for you. I believe in you. I believe you can face and figure this out. We're just not getting that. We're not going to get that in our culture.
That's exactly right. And that's why I on this crusade on my channel to talk about this, because I see exactly what you're describing. Mechanism, or like a description of physical symptoms being basically framed as the cause of the problem, like you see with ADHD or depression. Again, these are things we can measure, these things in the brain. You can measure that the brain is doing these things, but just because your brain is doing it now, just as you said, that only tells you about the state of what it's doing right now. Brains are constantly plastic and constantly changing the way that they operate. So the idea that somehow when we see physical symptoms or brain changes or whatever it is, that means that it's a not reversible condition and can only be managed using drugs or something else is just abhorrent to me, and it's not acceptable, and it's not true. It's not true either. So anyway, now you asked me at the beginning of this conversation what my channel was about. There it is right there. That's exactly what I'm here to talk about. So, okay. So I want to come back to something you said earlier. I think this will be another really good soapbox for you. So you mentioned, I asked you, do you think there are sometimes other root cause reasons why someone might end up being hypervigilant or having panic attacks or ending up with anxiety? And you said, yes, sometimes it's a traumatic event. Sometimes it's a series of stressors. So one thing that I've observed on social media recently is the word trauma has become very in vogue. And there are trauma universalists out there who are blaming everything on like subtle traumas. And I think, again, it's coming from a well-intentioned place of saying, you do need to look at your psycho-spiritual wounding for some answers and to move forward. But at the same time, it's also leading people to endlessly navel gaze and get stuck trying to release their traumas in order to get better. So I'm wondering what your thoughts are on all that.
Okay. Yes, this is certainly a kind of modern construction. I spend a lot of time thinking about this, like maybe who's benefiting from really our own fragility. First of all, I'm going to say this. Human beings are incredibly resilient. The simple fact that we're here right now means we had to have so many of our ancestors thrive, survive, and procreate. And we are the creation of all of that. In all of human history, we're talking about infant mortality, immigration, disease, war. We've gone through it all. When I think about it from a spiritual perspective, I think we've incarnated into these physical bodies for these challenges. There is no such thing as a life without challenge. We love, we bond, we attach, and we lose those people. They die. So we grieve, and we have the ability to recover from grief. These struggles that we go through in our lives, ultimately, I believe, are there to serve our growth. The most challenging and difficult times of my entire life, which others might identify to be traumatic, I see them as gifts. Gifts because I've learned so much through them and learned so much about myself through that process. That's not to minimize some of the horrific situations that people are in. I've worked with combat veterans, sexual assault victims, and so forth. Victims of survivors of childhood abuse. Listen, those are painful and terrible events in a person's life. I try to reserve the word trauma for events that have that type of impact. And really, that's how it's researched in my field. Even if you've been exposed to those near-death experiences, certainly like the invasion of safety and bodily integrity, the horror of like watching somebody die, the horror of being abused. Only about 20% are going to develop what's called PTSD symptoms. 8 out of every 10 people, 80% is going to move through that experience. And often when I come across these people, they're the wisest, sometimes the most loving and caring people I know, because you learn so much from the experience. You can have empathy for those who've been in difficult circumstances. They might have created something in their lives to serve others based on their own experiences. And the 20% of people who do, it could be, a series of prolonged trauma that can be very detrimental, or how they became avoidant copers like we discussed previously. So I want to say, yes, there's, there are traumatic events. There's criteria for them because they tend to occur outside of the degree of normality. Yes, everything is tough for everybody, but then there's these skewed events that people have to go through. Respect people who have to go through something like this, while at the same time really believing in their ability to recover from it and even create a life of purpose and meaning after it. And in the literature, there's something called post-traumatic growth. And that's exactly what I was referring to, is the tremendous growth that occurs from the experience. So I'm not ever someone who's going to demonize the idea of someone going through something that's traumatic. There'll be compassion and there'll be empathy, but it's an ultimate belief in someone's ability to move through that. Where we're at today is we've confused anything that's distressing with trauma. If you go through anything that's emotionally painful, well, then, of course, then you've been traumatized. And that doesn't mean that, like you said, there's not some wounds in your life or events in your life that have affected you. That's part of the growth process. That's part of the learning process. That's the experience of being a human being. You definitely want to have that. That is part of why we're here, in my opinion. But to call everything trauma is, again, to reduce it to these simple explanations that one core event or one relationship or multiple events are the cause of every experience you've had. We've seen people develop complete identities around these events, which flies in the face of everything that I think I spoke about today, with stories in our minds and the ability to be present focused. Even when those events have occurred, they've occurred in the past. And you are now in the present, the only place you can live, the only place you can create. So much about the hard work of going through traumatic experiences is being able to move past those experiences to live fully in the now. So when you drive people's attention, again, to anything that may be wrong with you is related to some event in your life. You're not creating a new story. And this is what I see with modern therapy culture, is they're almost like hunting for painful events in their past and then bringing their attention to it and now creating an entire identity and worldview through those experiences. And I find that incredibly damaging. Incredibly.
It creates fragility, like you said.
It creates fragility.
Yes.
And you're not supporting the natural resilience that exists in most people. Yes, when I meet somebody, I'm going to screen for those events. But again, 80, 90% of the time, we don't have to even go there because they've already naturally recovered from it. They've coped from it. And now they have separate problems in their life because the human experience is challenging and it's difficult. But if I, as a psychologist, believe that everything is trauma related, then I'm going to just take that person back to an event in their lives that was painful, but yet they've already recovered from and moved on from. So you have to be very careful, especially in the mental health field, is what are you co-creating with your clients? Now, if that person's stuck in the past and that person hasn't processed or gotten through that, well, then it might be appropriate. But for a time-limited period, what we're seeing at this point in the mental health industrial complex is people develop identities around it and then think they have to go into therapy for the rest of their life and be managed because they're survivors of trauma. And there's a victim culture and mindset that goes along with that harms them.
That's right.
And
that's right.
We have to be very, very mindful about when we're acting outside of what we know about human capabilities and resilience. I have a large center here, and we'll get calls in from parents who are so afraid, like their teenage daughter, their preteen child, just went through some friendship difficulties. Normal things that are part of the human experience and part of our travels in this life. I remember one in particular, there was a call in, my daughter's best friend moved to California. She's devastated. Well, that's not a reason, to come into therapy, in my opinion. And I'll have to instruct our intake coordinators on the other line to say, listen, we're not recommending that be a reason to come in, support her natural resilience and her ability to cope with it. If way down the line, she's really struggling and stuck and not making new friends and not moving on, that might be a reason for her to get a little bit of help, or for us to coach you on how to respond as a parent. But, we've just created this fragility culture that exists. And now everybody believes they need mental health treatment.
Yep. So now I'm going to push back on what you just said for the purpose of demonstrating that this is what you just described is kind of that pendulum response to the opposite end of the spectrum, which is also not great, because the people that I see are often what I think of as overcopers. They're so good at coping. They're so good at dealing with stress. They think of themselves as so resilient. They end up building up this arsenal of essentially avoidance tactics to just avoid dealing with anything difficult. They're not actually resilient. They're just not, again, they're coping with rather than fully digesting the things that are happening to them. So what ends up happening, at least from my viewpoint, is that I start talking to them, maybe we want to have a little bit of access to your emotions so we have all the data, right? Just so we have the data. But then they end up going to therapy and they go all the way on the other end of the pendulum where now everything is trauma and they have to release all the trauma and find every emotion that's ever happened to them. So to me, it seems like the healthy point is somewhere in the middle where we have the time to reflect and digest things that happen to us and grow from them, not artificially by bypassing them, but also not drowning in them. And I'm wondering what you think about what I just said.
Yeah, I remember a professor that I had in school, her professional identity as a clinical psychologist and as a research psychologist, she says, my expertise is in coping. So the person that you initially described as a good coper, I would argue that that's not effective coping.
Correct. Yeah.
So an ineffective coper is in the avoidance realm. So there is, I did my doctoral research on this with the eating disorder patients, where we examined the coping mechanisms of adolescent girls who were hospitalized and were under treatment for severe eating disorders. And I compared that to what's called healthy controls, groups of adolescent girls who never had a mental health problem. And I used very established measures of coping based on lots of different questions, scenarios, and so forth. And you saw the eating disorder group was heavily what's called avoidant copers or intrapunitive avoidance copers. So what you described, someone who avoids processing pain, gets busy all the time, distracted, all those things, that goes back to our discussion earlier. That's suppression of emotional states. Yes. There's obviously a lot of fear there. That person's afraid of being with their own mind. That person's afraid of being with their own memories and their own experiences. They don't move energy. And there's really good evidence in our literature that that can lead to chronic pain, all various types of symptoms that we end up labeling in the medical system. Intrapunitive avoidance copers are ones that will do harm to themselves to escape what they're feeling. Think food, bulimia, binge eating, turning to drugs, self-injury, things of that nature. And you compare that to what's called approach copers. Approach copers are the ones who face and solve problems. When they go through a hard time, they're able to be present with their emotions. They understand them as adequate signals that are in response to events that are going through their life. They use those emotions to their benefit because they face problems and they overcome them, and they're on a series of kind of transformation and growth through all of that. They don't avoid situations that are anxiety provoking. They don't avoid difficult conversations. They tend not to be people pleasers. That's approach coping. They solve problems. They're good problem solving. And obviously those people who are approach copers, on every measurable outcome, tend to do much better in life, right? Yeah. So that's kind of what I'm examining in that. If somebody's swinging to the extremes, all kinds of extremes can be problematic. And so walking this balance in life, even in a therapy session, so I might be doing what's called prolonged exposure for a traumatic memory. The only reason I'm doing prolonged exposure to a traumatic memory is the person has avoided the memory to such an extent that just the idea of talking about it or thinking about it, they break down. They become overwhelmed by just thinking about it, even if it was 20 years ago. It's very clear that they did not process through that. It leads to fragmented memories. It leads to nightmares, hypervigilance to cues that are related to those memories that might not even be connected. So simple interventions like prolonged exposure, writing a trauma narrative, reading that trauma narrative, listening to the narrative over and over again allows you to process those, experience the emotions related to them. And what you do is you learn that my emotions aren't dangerous. Thinking about something or remembering something isn't the same as reliving it. And that's what you hear from the worst of mental health professionals. They talk about things like re-traumatizing. No, you cannot re-traumatize somebody by remembering or talking about it. That's what's necessary to move past it. But once someone does, like once someone has already successfully processed that, they're not afraid of the memory or the emotions around it. Spending too much time on that is equally harmful. I mean, it's just really problematic. And I think there's just poorly trained mental health professionals who want to reduce every challenge to some event that happened to them in their lives. And there's good roots for that in like psychodynamic therapies and so forth. Again, you're absolutely right. You need to have somebody who understands the nuance, thinks through this, has a collaborative relationship with their clients, supports their resilience. And generally speaking, therapy should be short-term. They should be relatively short-term. And we see this in the literature. We don't see improved outcomes the longer somebody is in therapy. And there's an inherent conflict that exists because this is how therapists make a living. And if you get a good client who comes weekly and loves to just talk about everything that's going on in their lives, someone's going to keep them in therapy because it's a paycheck every single session. And so those are the inherent conflicts that exist. And that's why you have to meet a very high ethical standard and code if you're going to be in the helping professions, that everything needs to be in that person's best interest.
Mm-hmm. Yeah. Lots of stuff to chew on today. Before we wrap up, anything actionable? Any words of advice to people who are listening to this and who recognize themselves in this conversation? And feel free to, from any realm.
Yes, I have a daily practice that when I started doing it, it changed my life, and I think it's also changed the life of my clients. And it really speaks to a lot of things that we were talking about today, especially around attentional control and focus. Where are you going to focus your mind in your life? So I start my day every day with what's called gratitude practice, right? One of the things I ask my clients is, what do you do first thing when you wake up in the morning? I've made this part of my evaluation process. I'm going to say the overwhelming amount of people say they turn right to their phone. They pick it up, they'll check to see if there was any missed calls or messages, and sometimes they'll just scroll through maybe their email or quick social media. And I tell people, where your attention goes, your energy is going to flow. So now you're already feeding it into that algorithm, you're feeding it into technology. And so we're kind of giving up the sovereignty of our own mind. So I try to get my clients to have first thought and train themselves to be grateful and have their attention to what they're grateful for. One thing that I talk about with my clients when I introduce this, let's assume that they have use of their legs, which is almost everybody. I'd say if you were in a horrible accident tomorrow and became a paraplegic, you would do anything to go back in time and to be able to experience walking again. And well, here we are, right? You have the freedom to walk. How often are we really mindful and attentive to that freedom, that ability just to walk, even if it's impaired to an extent, right? That real freedom to be able to move our body. And so if you're having a hard time finding gratitude for things in your life because they're not going the way you want them to be, it's little things like that. I'm so grateful for this opportunity. If you lost a loved one tomorrow, what you would do to have a day with them, right? And so you cultivate that experience. You cultivate that mindset of gratitude to start the day. And I'm going to tell you, it affects your attentional focus for the rest of the day. And you bookend that at night where you get some form of a reminder. Maybe you put on your nightstand a little rock or something like that. I have a rock on my nightstand where it's a reminder to me to reflect back on my day and everything I'm grateful for that occurred in that day. And so now you're bookending, beginning, first thought, end thought, about your attention and focus on all the blessings that exist in your life. And I'm telling you, that has an incredible downstream effect on your consciousness and your attention, because we're going to have choices and we're going to have freedom. And the freedom and sovereignty of your mind is you get to choose where you want to focus your attention. Trust me, if you want to find every particular reason why you want to be miserable, there's enough out there to do that. You know, you can look at the state of our world. You can look at any particular struggles that exist in your life where you're mistreated, but that's going to fuel like just a very dark energy, you know, very low frequency energy of shame and anger and anxiety and resentment. You can create from that space. I mean, you certainly have the freedom to create from that space, but just know that you also have the ability to create from places of gratitude and love and joy. And just measure that. Do a 2-week experiment and do that every day. And then just kind of reflect back a little bit on its impact on you. 100% of the time, people talk about that being a positive impact. And there's so many things like that you can build into your day. But I would always start with the gratitude practice in the morning and night.
That's beautiful. That's a beautiful practice. And if it's okay, I want to add a little footnote on this. We are not describing bypassing difficult feelings that you're having. So you're not trying to stop thoughts or feelings that are difficult in the mornings by doing this. It can be sometimes, especially at first, it may be an and. A lot of you say the first thing I notice in my morning is my symptoms, and I think, oh my God, not again, or it's going to be a terrible day. Your job is not to control those thoughts. It's to change how you're reacting to them first and foremost. And reacting to your morning by doing a gratitude practice like this is a wonderful way to redirect your attention and to start off on a different foot, even if your automatic first reaction isn't something that you hoped for.
Yeah, we can control our consciousness and our attention. Even if you have a symptom, observe what the add-on is. There's always a judgment.
Yes.
I experienced this, and then the add-on is like, I can't handle this.
Yes.
Oh, not again.
There's the story.
My day's going to suck.
Yep.
There's the story again, right? And so we're trying to cultivate that diffusion and just move away from those stories. It's an experience. You're having it. Okay. Now we're also choosing other things to focus our mind, and they are both and. They all exist.
Exactly. Thank you so much for this conversation. And thanks to all of you for tuning in. We would love to hear your questions and comments. So if you're on YouTube, please drop them below. If you're listening as a podcast, come on over to YouTube to join the conversation if you'd like. You can also like, share, subscribe to my channel, follow the podcast. These things help us reach more people. And again, thank you, Dr. McFillin. What a pleasure and a delight to have you here. Thank you so much.
Thank you.
Take care, everyone.